As the world's governments, scientists and medical practitioners battle to control the COVID-19 pandemic, experts say the fight against a major disease such as cancer is being slowed or hampered. World Cancer Day is marked each year on February 4. Today is set aside to raise awareness of cancer and to encourage its prevention, detection and treatment. According to the Union for International Cancer Control, UICC, cancer patients are vulnerable to COVID-19 infections, thereby making the fight against cancer even harder this time.
We've taken a considerable hit in all areas of the cancer continuum, and this has affected all services, whether it's diagnostics, treatment, or survivorship services that are available for patients. What happened is the World Health Organization conducted a survey around May, which was early in the pandemic, and what we saw was out of about 56% of the 155 countries that had been surveyed had shown either partial or total disruption of their cancer care services.
In January, the total cases of COVID in Africa climbed to over 3.5 million. As governments tighten up measures to deal with a second wave of the virus, Dr. Mutebi warns of a possible increase in cancer deaths.
As a result of the lockdowns, patients' access, and the fact that we're having the priorities shifted to the pandemic at the expense of other non-communicable diseases like cancers means that we potentially are downstream going to see patients coming in with more advanced cancers. Already, I can tell you, like in Kenya, for instance, we had a lockdown in March, and then that was eased in July, and we were having patients coming in with their lumps all the way from February, finally coming in for a diagnosis. So there is a potential. We're definitely seeing the downstream effects, which means diagnosis at later stages, which definitely has poorer outcomes.
The situation can, however, be improved if necessary actions are taken.
You know, the pandemic has managed to stop everything in its tracks except the cancer cells. Those are the only things that are still continuing to grow. So that's why it's a clarion call to say this should be a priority. Irrespective of whatever else is going on, we still do need to prioritize care for our patients.
Since the year 2000, cancer deaths have increased in Africa by 45%. 500,000 deaths are linked to the disease each year, according to Think Global Health.